Before 2021, there were many reports about dispute claims of JKN program, the majority of which is caused by clinical coding dasen.
The Indonesian case-based group's INA-CBG is the payment scheme for the referral healthcare facilities of JKN program.
INA-CBG, grouped by ICD-10 and ICD-9 CM codes that published by World Health Organization or WHO.
The right code for the right diagnosis is very important to ensure the right amount of payments to health facilities so as to maintain the sustainability of the JKN program.
As a social security administrative body for health in Indonesia,
BPJS Kesehatan focus on service quality transformation and the sustainability of the JKN program.
one innovation is called the Team of Clinical Coding Experts, or Tim Ahli Pengodean Klinis TAPK. This video will describe the establishment, the roles, the capacity building, the transfer of knowledge, and the impact of the TAPK BPJS Kesehatan.
TAPK was established in 2021 through the Director of Health Service Assurance Decree. TAPK consists of 20 members from different provinces. The majority of TAPK's background education is a doctor. The majority age 35 to 40 years old and female is dominant. TAPK has 6 tasks. First, to have a minimum of 1 meeting a month to recommend solving the dispute claim, to revise the logic of the verification application, and to revise the claim verification process. Second, to pursue continuous learning about clinical coding. Third, to give sharing sessions about clinical coding. Fourth, to be a speaker about clinical coding. Fifth, to evaluate and report about clinical coding minimum every 6 months. And sixth, to help to draft regulation about clinical coding. TAPK has forged through several training courses at the regional, national, and international levels.
The capacity building and transfer knowledge of TAPK are described using the SECI model approach.
It is a model of knowledge creation that explains how tacit and explicit knowledge are converted into organizational knowledge.
In socialization, the TAPK converted tacit to tacit knowledge. For example, TAPK has received training from AHIMA International.
This training aims to improve understanding of clinical coding, quality medical records, and accuracy of data costing in Indonesia.
AHIMA stands for the American Health Information Management Association.
It's a professional association for health professionals involved in the health information management needed to deliver quality healthcare to the public.
The material of training is in accordance with WHO ICD-10 2010 and ICD-9 CM 2010.
Ministry of Health Regulation Number 26, year 2021, concerning the INA-CBG guidelines and the regulation of JKN.
Externalization is when TAPK takes tacit knowledge that's in his or her head and convert it into explicit. For example, TAPK was able to communicate this tacit knowledge to the IT teams. In combination, the TAPK is taking an explicit knowledge and making it more explicit. For example, TAPK planned to publish a handbook clinical coding. so the knowledge will be more explicit for more people. Internalization is where TAPK takes that explicit knowledge and convert it to tacit. For example, sharing session of TAPK to the Origin Work Unit. Based on the CGB Dispute Claim Settlement Monitoring Dashboard, there has been a decrease in the number of claim disputes after the formation of TAPK in 2021. First, there has been a 61% decrease in the number of medical claims dispute cases. Second, a 65% decrease in the number of coding claims dispute cases. And third, a 77% decrease in the number of claim dispute of the benefit coordination cases in January 2023 against the number of claim disputes in January 2021, the previous 2 years.
TAPK has succeeded in minimalizing dispute claims, covering medical, coding, and benefits coordination and expediting the claim process. Each member of TAPK has carried out the internalization continuously in their Origin work units and collaborates with the stakeholders.
First off, I just want to thank you from Ahli. We are so happy that we had the opportunity to come all the way to Indonesia to work with all of you. You've been such a wonderful group.
In terms of the training, I hope you have learned from me and Gina about training and training tips and how you go forward and utilizing some of those tips as you go out and train others. We also wanted to cover those problematic areas because we know there's disputes, just as we know we continue to have the same kind of problems. Maybe not be specifically yours, but we might solve them through coding guidelines.
Ini adalah suatu yang bagus meskipun teman-teman sudah punya bekal yang cukup sebetulnya untuk masalah coding dan manajemen claim ini, tetapi insight dari luar terlebih dari Ahima yang merupakan salah satu tolak ukur dari coding di dunia gitu ya, ini akan memperkaya dan membuat juga kepercayaan diri semakin meningkat karena kita mendapatkan informasi dari sumber yang sangat terpercaya ya di dunia.